You know that feeling, right? You wake up, go for a good stretch, and bam! A sharp, totally unexplained ache just shoots through your joints. Or maybe it's that stiff, lingering throb in your lower back after you've been glued to your desk all day. Honestly, it's something almost all of us deal with. Waking up with a body that just refuses to cooperate is incredibly frustrating, but you're definitely not alone in this.
Welcome to this explainer. I am super excited to dive into this with you today. We're going to take a really focused look at what's actually going on beneath your skin. The goal here? To take all those stuffy clinical definitions of bodily pain and translate them into real, actionable solutions you can use every single day. So if you're ready to figure out your body's mechanics and get your comfort back, you are absolutely in the right place.
All right, so here is our roadmap for today. First, we'll look at understanding musculoskeletal disorders. Then we'll get into the roots of joint pain, decoding your back pain, common knee pain triggers, and finally, managing and reducing pain.
Let's jump right into Section 1, Understanding Musculoskeletal Disorders, and taking a whole-body view.
When we look at how these disorders actually strike the body, you really see how interconnected the whole system is. We're talking about a full-body spectrum here. It encompasses everything from rheumatoid arthritis and osteoarthritis in the hands and knees, all the way to ankylosing spondylitis, cervical spondylosis, and of course, that classic lower back pain. It literally affects the whole shebang.
Now here's a really fascinating way to look at this, a more holistic Ayurvedic perspective. In this tradition, musculoskeletal disorders are tied directly to your body's energies or doshas. Vata is actually considered the most common dosha involved in this kind of pain. But if the pain comes from some sort of physical obstruction in the body, it's the kapha dosha that takes over. It's just a really interesting lens for framing the root causes of systemic inflammation.
Moving on to Section 2, the roots of joint pain, specifically looking at where our bones meet.
The thing you really need to grasp here is that joint pain isn't just one single feeling. By definition, it's physical discomfort that happens exactly at the junctions where two or more bones meet to form a joint. And this discomfort, it's a massive spectrum. It can be a super mild, annoying little ache, or it can crank all the way up to pain so severe it's completely disabling.
So, what's actually triggering it? Well, there's a pretty wide array of culprits. It could be inflammation in the cushioning pads around your joints or in the tendons that attach your muscle to the bone. Sometimes, it's the literal breakdown of your cartilage, especially around places like your kneecap. Then you've got acute issues, sprains, strains, even bone infections. And of course, chronic breakdowns like osteoporosis, which basically leaves your bones brittle and highly vulnerable.
In everyday life, this pain shows up in a few distinct ways. On one hand, you could be dealing with osteoarthritis. That's super common, essentially just a wear and tear disease over time. But on the other hand, it could be rheumatoid arthritis, which is totally different. It's an autoimmune disorder where your body gets confused and actually attacks its own healthy tissues. Oh, and let's not forget gout, which is this painfully acute condition caused by crystal deposits in the joints. Different causes for sure, but all leading to that intense, focused joint agony.
All right, Section 3, Decoding your back pain, focusing on our body's core support.
Honestly, if you've ever dealt with back pain, you know how incredibly democratic it is. It does not discriminate. It can strike anyone, at literally any stage of life, for completely different reasons. It might stem from a specific injury, some repetitive daily activity, or an underlying medical condition. But no matter the cause, it usually presents as a totally uncomfortable, debilitating roadblock to your day.
When you consider the intense structural complexity of the human spine with all those delicate vertebrae and nerve clusters, it's pretty easy to see why everyday actions put us at risk. Just picture your daily routine. Maybe you're standing or sitting for incredibly long stretches. Maybe you're overstretching or lugging around heavy objects. Even something as simple as sleeping on an unsupportive mattress that doesn't keep your spine straight, that is a huge prime culprit for localized inflammation.
But it's not just bad mattresses or heavy lifting. We really need to look at our modern habits. Craning our necks forward to stare at a computer screen or driving for hours without a break, that puts immense unnatural pressure on our core support. Combine those bad habits with deeper medical issues like ruptured discs or that awful shooting pain as sciatica, and it makes total sense why the back simply gives out.
Let's head down to Section 4, Common Knee Pain Triggers, and take a look at that crucial hinge.
Now, it is super important to note that knee pain isn't strictly just about bone hitting bone. Yes, it absolutely indicates an issue with the joint itself, but it also heavily involves all the soft tissues surrounding it. Those tissues are basically working overtime, desperately trying to stabilize that vital hinge.
Just weight and flexibility, your knees have to survive a whole gauntlet of other triggers. It could be a sudden injury from a bad fall, a dislocated kneecap, or chronic stuff like degenerative arthritis and gout. And here's the kicker. Even when you're trying to do the right thing and be healthy, having improper posture while you're exercising or lifting weights can instantly turn a good workout into a major knee injury.
Okay, finally, Section 5, Managing and Reducing Pain. Let's talk about your action plan.
So here is your core physical protocol. Step 1, actively watch and manage your weight. This directly relieves that mechanical pressure on your joints. Step 2, commit to 45 minutes of regular exercise daily. It keeps those joints flexible and strengthens the vital muscles around them. And step 3, this one is huge. Know when to rest. Resting is critical to prevent further damage. That means no heavy lifting, no strenuous forward bending, and avoiding excessive joint flexing when you're already in pain.
But physical movement is really only half the battle here. The food you eat literally acts as medicine. A healthy, plant-based diet packed with fresh fruits, vegetables, and whole foods actually boosts your immune system and fights pain. On the flip side, an inflammatory diet, we're talking heavy red meats, processed foods, saturated fats, added sugars, and excess salt. That stuff will actively aggravate the exact inflammation that triggers arthritis.
So you might be wondering, why do those fruits and veggies work so well? 2 words: antioxidants. These powerful little compounds, which are abundant in plant-based diets, get inside your system and literally hunt down and eliminate the free radicals that are actively causing your joint inflammation. It's like having a cleanup crew for your joints. Ultimately, if there's one thing I want you to take away from this entire explainer, it's this. You are not powerless. Musculoskeletal disorders can feel totally overwhelming, I know. But through mindful, daily lifestyle adjustments like managing your weight, exercising smart, and fueling your body with an anti-inflammatory diet, you have incredible power to protect your joints. So, I want to leave you with a question today. Think about everything we just covered, from the way you're sitting at your desk right now to what you're putting on your plate for dinner. Ask yourself, what is one small actionable step you can take right now, today, to build a stronger, more flexible, and completely pain-free future for your body's foundation? Thanks so much for learning with me today on this explainer. See you next time.